Okay. Good morning, everyone. Thank you, Dr. Drais, for giving this opportunity to speak up on OCT and geography, basics, and artifacts. I uh, One second. I don't have any financial disclosures. So the rate of change in innovation is really breathtaking and exciting. And the challenge comes when we try to understand what OCT and geography is and what it can try to accomplish. So the increased resolution in imaging machines has really changed the concept of understanding. Hence, it's not what you look matters, but it's what you see matters. So with the message of seeing is believing, I'll start my presentation. First of all, what is OCT in geography? It's a non-invasive technique, completely dye-less, uses motion contrast to obtain high-resolution volumetric blood flow data and provides localization and delineation of structure as well as vascular pathologies. Now, why do we need the OCT angiography? We need it because it provides three-dimensional visualization of retinal and choroidal vasculature. There is no need of dye injection. It is completely non-invasive, helpful in patients who have chronic kidney disease, allergic to dye, and require frequent monitoring based on the imaging. Another thing, it can able to segment different layers like superficial, deep, which is not possible in the fluorescent angiography. Now, if we look at the PubMed search for the last 10 years, we could see that a lot of studies have been done on OCT and geography, and literature have really provided us some very interesting articles to read. So, with the cumulative knowledge, we are progressing further, but yet we need to discover more in terms of understanding, misinterpretation, or links. Are we seeing the true flow or the false flow? So, let's start with the basics first. First of all, the principle of the octa, as we all know, octa is based on the motion contrast technique. So what happens when we repeatedly scans a particular area? So a numerical value is generated based on the sensitivity of that location. Now that numerical value, that memory location is called a voxel, which is a blend of pixel and the volume. And this voxel is attributed to the transitions, which are called noise. So if the signal strength is high, the noise will be low, and the converse. Later on, this numerical value is transferred by the computer monitor on the as an angiogram, and what you look is like a NFAS, which is giving the which provides the structure and the flow information. Now, among all these, the flow is very important. How is this? Sorry, flow motion is important. So, how is this motion generated? There are certain tools in Okta to know. First is the speckle, and it's a method of detecting the motion contrast. What is speckle? Light is travel in the form of waves. Now, when it strikes on the reflective surface, it forms a secondary wavefront that can be constructive or it can be destructive. So, constructive wavefront is called a speckle. So, what happens if we go back to the principle, if the when the successive scans are coming, if the object is not moving or it's stationary, there will be no change. But if the object is moving like this, so the different waves front will be seen, and only object moving in the eye is the RBCs, which is contained in the blood vessel. Another important tool is a decorrelation. What is that? It is the amount of change in the region from one image to another. But here in this picture, important to know is what is TS and what is TF. TS is the acquisition time taken by the beam to scan a particular region, and the TF is the flyback time. When the scan has come, it has to go back to its own position. And what is this L delta T? Delta T is an interscan time, which is a sum of TS and TF. This interscan time tells us about the sensitivity and specificity of the octa. Now we have a principle called variable interscan time analysis. Generally, it is a 5 millisecond, but we can increase and decrease. But by increasing the interscan time, you're allowing the slow moving RBCs to giving a greater chance to move between the scans, but yet it provides the image artifacts, and the shorter interscan time will capture the movement of fast moving RBCs before it exits the length of the OCT beam. Another important tool is the masking. Now, why we need the masking? We need it because it helps in image processing. Thresholding is generally applied on the data to remove the regions with low signal or noise. Now, we need a octa has to be reliable only when the signal strength is high, and only artifacts can occur because of the presence of attenuation. So, wherever you will see a low signal, it will appear as black, and wherever there will be high signal, it will appear as flow. So if in cases of low signal regions, if there are random fluctuation of noise, it can create a false appearance of flow, like it's called false positivity. So in a case of RP atrophy or the choriocapillaris atrophy, you can visualize the deeper choroidal vessels, and that can be misinterpreted as flow. Thresholding also means that octa cannot detect flow in low signal regions. If even if it is present, that is false negativity. So the absence does not mean there is no flow. Let's see, take the example of the choriocapillaries. Suppose in the vascular and the structure, both are giving a dark signal. That means it is a signal loss and in presence of attenuation artifact. But if it is dark on the octa and it is bright on the structure, that means this OCTA measurement is valid and there is a true flow or the flow impairment, or what we call as flow void. So low OCT signals or the absence does not mean it's a choriocapillaries loss. Another important tool is the registration, which is NFAS, and what is the visualization method, what we are seeing. How does a normal angiogram looks like? We have a superficial plexus, deep plexus, and we have a avascular, then we have a choriocapillaries. If you see, all the architecture is completely different from each other. We have a honeycomb kind of arrangement in the choriocapillaries. In the deep plexus, we have this net kind of structure, and superficial is formed by ganglion cell layer, inner plexiform, deep is formed by inner nuclear and outer plexiform. But the beauty comes out when we try to understand the pathology on an NFAS visualization. So I have taken an example of RAP. This is a color photo. This is a fluorescent angiography, which is showing a leakage in the later frames. Then we have this OCT, which is showing this outer retinal edema, cystic spaces, and the vascular complex over here. Then this is a color-coded generated Octa map, which is showing this retinal anastomosis. Now, when we put all the infas together or the separate layers, we found this kind of track of the lesion. So this track is like retinal anastomosis emerging from the deep retinal plexus, forming a high tuft-shaped flow lesion at the avascular area, which is connected to the choriocapillaries and the choroid formed by the deep feeder branch. So you can postulate whether this pathology is horizontally placed or it's a vertically placed. So that's the beauty of the infas. Another example I would like to share is of PDR. You can say in the fluorescent angiography, NV looks like this, very hyperfluorescent, but on the Octa now we have a montage facilities where you can mix all the images and can have a wider field of view. So the NVE looks like this, very this exuberant proliferation of vessels. You can have thinner branches, you can have peripheral loops. Now when we place this slab placement over this area, you will see the presence of flow. So that gives an indirect evidence that it's an active NBE. And whether it's elevated or not, that you can look in the VR interface lab. So this is a manner how can you read the Octa on an infas. So let's come to the artifacts. Even with the best imaging modality, the images are not always perfect, and there are always extra missing links, which are called artifacts. And what is the rule of imaging? In an imaging system, there is an object to be imaged and an image to be created. The image is a transformation. And what is the rule of the Octa? Octa means you sit on the machine, you see where is area of interest, and then you do the accurate segmentation. So let's start with the first movement artifact, which occurs because of the gross movement of the eye. And you can have a horizontal, vertical, dark or bright lines, how it looks like. Now, as we know, OCT creates this kind of raster pattern, and if there is no movement of the eye, this kind of image will be produced. Suppose the eye move in this direction, the black arrow, then you will see the white line at the junction of two images. And on the OCT angio, you will have this kind of motion artifact. This is with artifact and this is without artifact. Uh, but software do have a capacity to compensate all these all motion artifacts, but then they create their own artifacts, which are called compensated software artifacts. Which are those? These are vessel doubling, where two copies of the vessel will be seen, like shown in the red arrow. Again, then second is displacement artifact, where part of the image is from one region, another from the discontinuous region. And the stretching effect, where the completely image has gone, it's like a stretch, like a rubber sheet. So these are some software artifacts. Another very important artifact is a projection artifact. What happens when OCT beam penetrates a superficial capillary plexus, then a portion of light is reflected back, but some light travels continue and reaches the RP, which is itself a natural reflector. Now, whatever light arriving at the RP is always influenced by the flow present above it, and that really gives the erroneous appearance of a superficial vessels in outer retina and RP. So this misinterpretation of flow is termed as projection artifact. We have some natural reflectors in an eye, like RPE, plexiform layer, choriocapillaries is very confusing structure, stroma giving stromal decorrelation artifacts, sclera can give segmentation artifacts. So these are some examples. Deep vascular plexus is really suffer from the projection artifacts from the superficial vessels, as shown by this arrow. Again, this is imaging at choriocapillaries, source of confusion, I would say. This is a case of sub-RP neovascularization. Now, when the slab placement is at the level of RPE, you can see some imprint of flow. But when the slab placement has been done just below the RP, the actual vascular network has come out. So this is a case of type 1 CNVM. Another drusen's, yes, drusen's which are not harboring any CNVM, then can produce image that seems to have vessels giving projection artifact. Edge of the PD is really provides false positive decorrelation signal on the Octa image. So these are certain examples, but we have some algorithms to overcome these artifacts, which are slab subtraction of the projection resolved Octa. Slab subtraction is they remove the bright, they subtract the Octa infas image superficial from deep, but then they produce dark vessel artifacts, which are really unacceptable ones. And projection resolved Octa is little better because it provides the continuity of deeper vascular layers. Another artifact is the segmentation errors, which has failed in the retinal edema, atrophy, or high myopes. Interpretation errors can occur, but you can avoid them by seeing the contours in sequential OCT B scan images. Now we have this very interesting OCT interpretation basic toolkit, which I would like to share. So suppose first step, just mark your area of the interest. What is the area of interest? And then you see the en-face images. See superficial, avascular, choriocapillaries. Suppose your pathology lies in the choriocapillaries. So now then take the segmentation line at this level, because improper slab placement sometimes misleads the pathology. Once you have done the proper slab placement, then you look at the B scan overlay, whether this flow is present or not. Now you have to look whether your flow, what you are saying, is true or false. Then you look at the en-face intensity image, whether this is giving the bright signal or dark signal. Suppose it is giving dark signal and it is dark on the B, this NG also, that means there's a signal strength is low, and whatever you're saying, it's a false flow. So this is how
Sorry
you
to interrupt, ma'am, but the
go.
timing is up.
Okay, but 2 slides more.
Ma'am, other discussions will get delayed if we, extend the session. I'll request you to conclude.
Okay,
Just give a summary, Priyanka.
okay. Just
Few seconds.
limitation cannot visualize leakage, and retinal segmentation. It's dependent on retinal segmentation. And artifacts makes interpretation difficult. So top 3 tips: always correlate all the layers. Sometimes video analyzing helps in decreasing the chance of segmentation artifacts, and important to analyze layer by layer. Thank you.